As you can see, I'm reporting from home tonight out of an abundance of caution over some recent context. There's a lot of confusion nationwide right now about the guidelines from the CDC after they cut the recommended quarantine time in half for people who had tested positive for coronavirus. News Channel 3's Samantha Lomibout is live in Cathedral City tonight with a breakdown of the new guidance and why it's now kind of a point of frustration for a lot of people. Samantha.
Good evening, John. Yes, I'm in front of the Coachella Valley Repertory where they say they're following strict COVID guidelines. Now, those are the same guidelines that are causing confusion nationwide. I'm sure if you've been on social media recently, you've seen all of the memes and the jokes pointing fun at that guidance. Well, all this back and forth in the CDC has left a lot of people confused about what to believe. To test or not to test? It's just one of the many questions people are asking after the CDC adjusted its quarantine guidance last week.
So crazy. There's so much confusion. No one knows what to do. Everyone has the mask, then they're not wearing the mask. It's the 5 days, 10 days, it's confusing, but all I know is I'm just keeping the mask up for a while.
The agency recommends people should isolate if they've tested positive for COVID-19 to 5 days instead of 10 if they don't have symptoms and wear a mask. As long as you don't have symptoms once your 5 days is up, a negative test is not required to end that isolation period.
Most people who've had COVID know it lasts like 2 weeks. So that's the only thing that's a little confusing for me is the 5 days, 10 days. But it seems like it's just always changing and evolving to kind of make it work for maybe businesses. I don't know.
But Riverside County Deputy Public Health Officer Dr. Shunling Singh encourages getting tested no matter what.
Because we're trying to help people end their isolation earlier. That's why we're recommending the antigen test, at day 5 if you want to try to shorten your isolation.
Another question many people are asking, why now? Why the sudden change in guidance while COVID cases are surging nationwide?
I think the reason why things are rapidly changing is because as we find out information, we're trying to push it out in real time because people need it in real time.
The CDC explains their decision, saying people are most contagious 1 to 2 days prior to onset of symptoms and then 2 to 3 days after.
How do we live with this virus? And we're letting science help guide us so that we can still, coexist with this and, make sure we're still keeping everyone safe.
The agency has also cut down the quarantine time if you've been exposed to the virus. If you're unvaccinated or partially vaccinated, you're urged to isolate for just 5 days and wear a mask for the next 5. But if you're fully vaccinated with a booster, you don't even have to quarantine at all.
I think that's scary too. If I was exposed, I think I would quarantine because who knows if you got it.
Now, the state's indoor mask mandate was extended another month just yesterday amid a surge in cases, and that's also garnered mixed reactions. Now, for a more in-depth breakdown of the CDC's guidelines, just head to our website, kesq.com. Live in Cathedral City, Samantha Lomibout, News Channel 3.